Guys, it's Dr. Greer, board certified plastic surgeon in Cleveland, Ohio. I wanted to do a really good informational video today about lip fillers. Lip fillers are one of those topics that are really often posted on social media because it's great before and afters, and it's one I get a lot of questions about. So I wanted to provide a good overview of what lip fillers can do, what the risks are, who you should go to, etc. So if you've thought about getting them or you have questions, keep watching. The first question people often have is, who should I go see for lip filler? And you will find a million different types of injectors out there. There are three core specialties who are trained in facial aesthetics, especially toxins and fillers. And those are, of course, your board certified plastic surgeons, also your board certified dermatologists, and then there are board certified facial plastic surgeons who do a residency in otolaryngology and then do specialized training in facial aesthetics. Those are the core specialties. We get our training during residency, but you will see other specialties. Like I've seen ER docs do fillers and toxins. I've seen family med. And then of course, you'll also see nurse practitioners and nurses. And we have both a nurse and a nurse practitioner doing fillers and toxin at our office. So who should you go to? Obviously you want somebody who's going to get you a good result, but you also need to consider safety. And I'm going to talk about complications a little bit more at the end. But you should know there can be some scary complications from fillers. And if your injector doesn't know how to recognize or manage those complications, or if it's someone who doesn't have oversight, like, if you're seeing a nurse practitioner at a med spa and they're being overseen by like a family medicine doctor in a different state who doesn't even do fillers, that's a little bit scary. So I would always ask wherever you go what the potential complications are, how they would recognize those complications or what you should look out for, and how they would treat that or who they would bump it up the chain to. If the answer is go to the ER, that's not going to be helpful. You want someone who knows exactly what can happen and what to do with it. So that's my biggest advice on safety. You can also ask about training and things like that too, but really look for good results and safety. Okay, so that said, assuming you have found a place you want to go, what are lip fillers? What is getting them entail? So lip fillers are obviously any kind of volume added to the lips, but they're almost always composed of hyaluronic acid. And hyaluronic acid is a normal structural component of your skin and soft tissue. It's like a very slippery, clear substance, and it actually is in your joints as well. We like hyaluronic acid for the lips because it's so pliable and flexible, and that's an area with so much motion. If you have a stiffer filler, it could form lumps and bumps, which you don't want. Hyaluronic acid fillers include Juvederm, Restylane. Obviously, there are a billion different options within those families, like Restylane Kiss, Restylane L, which is the initial one, Restylane Silk. So lots of different options. And then there's also the RHA fillers by Revance. And we carry Restylane and RHA in my office. I don't use Juvederm very much anymore. I don't recommend permanent fillers ever to the lips because if you have a problem, you're looking at surgical excision. There are some surgical options to add volume. I don't do those. I don't know a lot about them, so I'm not really going to touch on that here. But lip fillers are very, very popular. Fillers overall are increasing in popularity. I think there were like 2.6 million filler procedures last year, and a lot of those are the lips. So chances are you know someone who has lip filler, even if you don't realize it, because a lot of lip fillers, especially in my area of practice in the Midwest, look very natural. I have lip filler right now. The goal is not duck lips or Kardashian lips. So you may not even realize that someone you know has filler. All right, so now you know what they are. You know who to go see. What should you do before you go? I always recommend thinking about what kind of result you want. Do you want a different shape? Is there a little asymmetry you want to correct? I had one patient who just had like crinkly dry lips, and adding a little filler kind of softened them and made them look plump without being bigger. Are you working on lines around the lips? Do you want a really significant size increase? Being able to clearly explain that makes it much more likely you're going to get the results you want. Also, avoid any medications that cause bleeding in the week before your appointment. So that would be aspirin, anything with aspirin in it. Also naproxen, which is Aleve, and then Motrin or ibuprofen or Advil. And if you forget and take one, just know that you're at a little bit higher risk of bruising. I do have a couple patients who are on blood thinners like Coumadin who get lip filler, but that's something that we've reviewed carefully and discussed the risks versus benefits. So it's not a no-go, but make sure that your injector knows about it if you're on any blood thinners. On the day of your appointment, expect to be there like a half hour or 40 minutes. We use a topical numbing cream in my office, and I leave that stuff on for a solid 10 minutes so that your lips are really, really numb. I also have a couple other tricks I like to use to make sure you're comfortable. I put ice on right before each injection, and then I have this little thing that looks like a Bic razor. It's called a beauty bar. I put it right next to where I'm injecting, and it vibrates, and that vibration distracts you from the little pinch sensation. So getting lip filler can be anywhere from like hardly felt it to kind of painful. Using the numbing cream and the ice and the vibration definitely keeps it in the very tolerable discomfort range. I have had lip filler once without any numbing cream when I was in residency, and 0 out of 5 stars, do not recommend. It was awful. So if you've ever been to an office and gotten lip filler without numbing, please know that it can be much, much more comfortable than that. The actual injection takes about 10 to 15 minutes, and you will see the results immediately. You will also have some swelling immediately. Everyone starts to swell right away, even while you're there. So you'll see an improvement, but the end result's going to be probably a little less full than that. I do like patients to ice right away for about 5 minutes. We give you a little ice pack, and then ice again that night for about 5 minutes. That just helps decrease some of the inflammation and swelling. Lip filler often does swell. I myself look like a duck the next day, so just plan for that and know that if you look really puffy, it's going to get better quickly. Usually by day 2 to 3, you're back to normal, although there may still be a little trace swelling for a week or so. So I don't tell you to evaluate the results in terms of volume for a good 2 weeks. It's also common to feel little lumps and bumps from the swelling. That's normal. Do not worry. Gentle massage can help that settle. And if you're really having a lot of puffiness or soreness, take some Motrin, take a Benadryl, do some ice. That will help pretty significantly. Lip fillers last anywhere from 6 to 9 months for your basic Restylane or Juvederm. There is a new Restylane product, Restylane Kiss, which lasts up to a year. I've used that. I like it. It's very flexible and feels very natural. And then the RHA fillers by Revance last up to 15 months. So if you've had filler before and you know you like it, that is a great option so you don't have to come in and get injected as frequently. The longer lasting fillers come with a little bit higher price tag, but it's a great value for how long they last. Other things to know about fillers, how much you'll need. Most people, I use a 1 ml syringe. If they don't want a lot of fullness, sometimes we'll put a little bit in the smile lines. For someone who just wants a tiny bit of a plump up, Restylane comes in a 0.5 ml syringe, which is a really great option. And then for somebody who wants a really significant size increase, you might use 2 ml. So on average, I would expect 1 syringe of filler. Let's talk about complications now. They're really rare. Most people experience mild bruising and swelling, and that's really it. It's possible to have little lumps or bumps that don't settle out with the swelling, and that is usually dependent on injection technique. But if you have that, follow up with your injector. I'll have people massage a little bit and know that they do settle out with time. I am often asked about filler migration, which is filler moving somewhere else after the fact. It's not something I'd really heard of in training, and it seems to be this topic that's discussed more and more on the internet over the last year. So I did look up the actual research. There is not a lot of data to explain, like, is the filler actually moving 2 months down the road, or was it just kind of diffusing to a different place when you injected it? And I suspect it's the latter, because when I inject lip filler, when I'm injecting right along the edge, you can see the filler diffuse to other parts of the lip. So I suspect that it's just going different places during the injection process rather than like 3 months down the road, moving up to a different spot. I would not worry about your filler moving to a different spot, once you're a couple of days out from injection. It gets pretty well incorporated and stays where it is. So filler migration, not something I personally would worry about. If you don't like the results, 9 times out of 10, I will recommend just waiting and letting it break down naturally. We do have hyaluronidase, which can break down hyaluronic acid fillers. I usually reserve those if somebody's got some significant issues like there's a little bump or a nodule, or like say they had an infection, which is very rare. I've seen it maybe once. Or if there's just a lot of swelling or inflammation, then we would use hyaluronidase. But hyaluronidase also breaks down your own hyaluronic acid, which could leave your lips even thinner than they were before. So most of the time, just wait it out. It will get better with time. And then to end with the complication section, I do want to mention vascular compromise, because this is the big serious complication that can happen with fillers. And vascular compromise is if some of the filler gets into a blood vessel. It can cause skin necrosis, meaning the skin actually dies. That is particularly high risk in the nose and in the glabellar. So those are areas where I would really only recommend getting injected by a physician. And if it happens in the vessels around the eye, it can cause vision problems or blindness. It is thankfully very, very rare. I've never seen a case, but it's critically important that you have an injector who understands the tissue planes, knows where the danger areas are, and most importantly, can recognize if there's a problem. Vascular compromise, like if you have blurry vision or spotty vision after injection around the eye, that's something to tell your doctor right away. And any other areas, if you get like a bluish or purplish discoloration in a patchy area after filler, that is something to bring to my attention immediately, because that's what vascular compromise looks like. And knowing how to treat it is critical. So in my office, my nurse injector and my NP injector both know how to recognize it. Obviously they have my cell number and they can call me for any concerns, but we also have an emergency kit with the protocol taped to the cabinet explaining exactly what to do, and we have the appropriate medications in the office. So that is something I would definitely ask wherever you get treated. If there's a vascular compromise, what does it look like? What are you going to do to treat it? Because there are several things right away that can make a big difference. It's not something, again, I ever expect to use that emergency kit, but if we need it, it is there. So that's what I have to say about complications. In general, lip filler is very well tolerated, very safe, and it gives great results. You can expect the appointment to last about a half hour. Do ask for numbing cream beforehand because it makes a huge, huge difference. And most of the fillers will last 6 months to about a year. Average cost is anywhere from $600 to $800 depending on how much filler and the specific type you have used. I hope my guide to lip fillers was helpful. Please hit follow if you don't already follow me so you catch future videos. And if you have questions, leave them in the comments and I will definitely get to them.